Hello, everyone. Welcome, welcome. It is time for another Toolbox Tuesday. If you have not been with us before for Toolbox Tuesday, every Tuesday in our practices, we pick one of the hundreds of resources that we have available in our toolkit, and we focus on one of those resources just to make sure that our team members are all on the same page with what we need to do and calibrate that resource. So we have started a new series here on Toolbox Tuesday called Team Talk, and this is focused specifically for team members for some of the dental education topics that honestly just might be missing in either your training or if you've had experience in the past or have gone through a dental assisting program that really just help you kind of understand the background of what your owner doctors are doing and the practices that you work for. And honestly, the doctors are busy, right? They're seeing patients. They may not have time to stop and give you some of this background information, or they may not even realize you don't know that information, right? Because they've been doing it for so long that we skip over things. Sometimes we just take it for granted. It's just like second nature. So one of the big topics and the questions that I've had come up, and we've posted these polls and question boxes on our Instagram account. So if there's anything that you would like to see us talk about, please feel free and put your suggestions in there, and we're happy to talk about it. One of them is just from a clinical standpoint. So we're going to be breaking down some of the biggest clinical questions that come up over the next couple of weeks, because this is for both back office and front office, right? Assistants, you guys are getting this chair side from your patients as soon as your doctor walks out of the room. While they're in the room, it's yes, doctor, yes, doctor. As soon as the doctor walks out, they're turning to you and going, okay, now tell me what the actual deal is here, right? One of the age-old questions is, why do I need a crown? Why can I not just have a filling? Okay, well, there's more than one reason usually why you need a crown versus a filling, but just breaking it down. And again, we try to talk to our patients in patient-friendly language. So I do the same when we're talking with our team members. Our doctors, bless their little souls, but they go down a clinical rabbit hole a lot of times that patients can't follow, and it can confuse them. So we keep it basic. We make sure we're using the same terms. The big two differentiating factors between a filling and a crown. A filling does a really good job at plugging a hole. Okay, it's like a pothole in the road. It is not adding any strength to the road. It is filling a hole. When either decay or fracture or loss of tooth structure, or you have an endo, when a tooth has been damaged in some way, shape, or form, you get to a point where there is not enough remaining tooth structure to hold on to a filling. Because a filling does not impart any strength to the tooth, it relies on tooth structure to be able to hold on to. If you don't have that tooth structure to hold on to, you have to protect the tooth circumferentially with a crown. A crown is going to go all the way around the tooth. Now, it does not heal a fracture in a tooth, but it will kind of hold those pieces together. If you just place a filling in a tooth that is fractured, not only are you putting the tooth at a bigger risk for fracture down the road, but it doesn't have any other strength. So it's like splintering as you go. That filling can actually make it worse and actually create kind of a wedge that creates another weak point that could cause a tooth to break beyond the point of repair. And that's something that I think a lot of patients don't realize because they don't know, right? They're relying on us to give them this information. You can fracture a tooth to the point that you can't save it anymore. Fractures in a tooth are like a fracture that goes in a windshield, right? It just keeps going and you can't control always where it's going and where that fracture is going. So if that fracture continues to go down the root of the tooth, all of a sudden you can't save that tooth anymore if it cracks vertically. And we don't have control over that because a lot of times patients will just say, oh, that's fine, I'll fix it when the tooth breaks. You may not have the option to fix it once it actually breaks. So those are the two differences between why can't I just have a filling? Why do I need a crown? Filling fills a hole, crown will actually impart strength on the tooth. Now, I know it's a leap for a lot of patients, right? Crowns are more expensive than fillings are. They're also longer lasting than fillings are. And if we are dealing with a situation where we are trying to save a tooth and prevent further breakage, in our practices, we are always trying to recommend the treatment for patients that we know is going to be the longest lasting for them. We don't want to waste their time and money and energy doing a filling for a couple $100 that we know isn't going to last 6 months and just pray that that doesn't contribute to that tooth breaking further. That's not doing our patient a service at all. That's doing them a disservice by making sure that we haven't done our part by making sure that they know the education piece of this and why it is that we're recommending that. It's not just because a crown is more expensive. There is an actual clinical reason as to why we are recommending this. Now, when it comes to root canal teeth are more brittle because they are not alive anymore. We have taken out the nerve in the tooth that was alive. We are filling it with filling material. that tooth is brittle, that tooth is more prone to break. We have seen this happen so many times where a patient says, okay, well, I'm going to do the root canal this year. I'm going to wait next year until my insurance renews, and then I'll do the crown. And that tooth breaks in that year while they're waiting for the crown. And now they've wasted all of that time, energy, and money in doing a root canal again for a tooth that cannot be saved. So if we're presenting a root canal treatment plan to a patient, we make sure that they know the crown needs to go along with that. Otherwise, we're not, again, doing them any kind of service. So I hope that that helps clarify just some of the basics between fillings and crowns and why we recommend those things. Please feel free to come back next week. We're going to talk about locator cases versus all-on-X cases. Those I know are some of the bigger ticket items that people get really nervous when presenting to patients, but they could be some really great restorative options for patients. So come back next week for Team Talk. If you have questions in the meantime, please feel free to reach out to us, connect@pivotdentalsolutions.com. We're on all the social media platforms, and we do have a team training program that's available that walks through some of these things for you so that you can feel more confident in your career, in your position, and having conversations with these patients. So we'll be back next week. I hope to see you guys then.